The following segment is sponsored by Moda Health.
Thanks for watching Afternoon Live. To help stop the spread of COVID-19, people are staying home. But what if you get sick and need to see a provider? Joining us to share how virtual care can help you and your family get the care and stay healthy during the COVID-19 outbreak, we welcome the Senior Medical Director for Population Health and Delivery System Collaboration at Moda Health, Dr. Jim Rickards is with us. Dr. Rickards, that's quite the title.
Yeah, it is.
That's a mouthful, but I'm glad that you're here because some people think that they understand what virtual care means, but why don't you tell us how it works and exactly what it is?
Yeah, well, virtual care really refers to the delivery of any type of medical service or behavioral health service, such as a counseling session, not in an in-person fashion, but virtually. So through a phone, a mobile device, laptop, via texting or chat. It's pretty broadly used now, especially during this COVID outbreak. Many more providers are offering virtual visits. Some providers, that's all they're doing. For instance, my wife, she's a behavioral health provider. She used to see 8 to 10 people in clinic in person. Now she talks to them all on the phone or does video conferencing with them.
Well, that's really cool. I'm glad that people are still able to get care. But there are people like my mother who refuses to believe that you can actually get any kind of health care if you're not in person. It doesn't work. But you say, no way.
Well, yeah, I think that's true in some instances, but there's a little secret in medicine that about 90% of the time, if you just have a conversation with your patient and you really listen to them, you can make a diagnosis. So really about 90% of the time, just that virtual interaction, that call, even just an email, a good provider can come up with the diagnoses. Now, when it comes to treatment, things might be a little bit different. If the treatment involves counseling, such as I mentioned my wife is doing, sure, a video visit or a telephone call would work well. But if somebody needs a surgery or some type of intervention that requires, a physical encounter, then a virtual visit probably is not going to work well for that treatment aspect.
Understood. So let's say that you feel like you need to see a doctor. What do you need in order to facilitate a virtual visit?
Well, fortunately, technology has come a long way. And I tell most people that the majority of virtual visits can be performed through your smartphone, through your iPhone, through your Android device, etc. A lot of clinics now are able to use just regular consumer type technologies, things like FaceTime or some of the video applications available on other social media sites to conduct these virtual visits. There's been some relaxing of what are called the HIPAA requirements or the security requirements around the technology we can use. I suspect that those requirements are going to come back once the COVID pandemic passes, but for now, it's pretty accessible through any device and really through a variety of different technology platforms.
And does insurance cover virtual visits?
In general, yes, and there's been a large expansion of coverage lately. I always recommend that individuals check with their own insurance carrier. There are slight variations for what's covered from Medicare to Medicaid to different commercial plans. So double check what your insurer is covering, but in general, most visits are covered now that are delivered virtually.
Okay, good. And what advice can you offer people so that they can have a good virtual care experience?
Yeah, well, I recommend whenever you start, especially a face-to-face or what's called a synchronous visit where you're acting in real time with someone, to make sure you introduce yourself, but then also have the provider introduce themselves to you. So you're just making sure you're speaking with the right person. And then also, just as when you would go see a provider in person, try to list out your questions beforehand or even type them out and send them via email beforehand to make sure that you cover everything you want to so you don't have to make another visit. And then also make sure that if you are doing a video visit that you're in a private, secure area, perhaps the room is well lit. And then also if you are using a mobile device that you have a good charge in your battery and good reception so you don't experience any technical challenges.
Right, that's a good one that I bet a lot of people don't consider, having a good signal and all charged up. Okay, now just real quick, what happens if you are on a virtual care visit and you're not getting the answers that you need, or how do you know when you actually need to go in person?
Oftentimes the providers will be good about suggesting if you need to come in for a bricks and mortar or an in-person visit or not. You can always though seek a second opinion, just as you can with a provider in a face-to-face session in the real world, so to speak.
Okay, well, thank you very much, Dr. Rickards. This has been very helpful for a lot of people.
Yeah.
All right, take care. Okay, so for more information on how virtual care might be a good option for receiving medical care during this COVID-19 outbreak, visit modahealthminute.com, or of course you can always head to our website and we'll get you there from katu.com. Don't go away, we'll be right back.